one of the things that really is not well understood and equally important, probably more important, is not well taught in dental schools is color. I don't think really there's very few dental schools out there that teach color well at the undergraduate level. And so most dentists are graduating, as myself, with very little understanding of color, and we're living in an aesthetic world. Our patients are wanting us to enhance their smile in some fashion, and we don't have the ability really to do what I call shade selection and then shade reproduction. So we need to first do shade selection and determine, hey, what shade does this patient have, especially if we're doing minimally invasive dentistry, where I'm only doing 1 or 2 or 4 restorations. If you do 20 restorations, you pick your own shade, and everyone's going to pick A1. Okay, that's what the patients are going to want. But when I have to match one single central, you need to understand color. You need to understand hue, chroma, value. And these things, they're not taught in dental school, unfortunately, and there's not a lot of individuals out there that teach it. I like to teach it. I know Radha's here, and he's a fabulous instructor, educator, and knows color as well as probably anyone in this country. And so I look forward to his presentation on color, but that's a really important science that we really need to start spreading the news, if you will, spreading the word, let the clinicians really understand better the science of color, how we apply it to our patients. And for me, like I said, it's shade selection and then it's shade reproduction. So now we select the shade for this individual, let's say, be it a crown, be it a chip on a tooth. How do we reproduce it? So how do you get that composite to build in the fabulous nuances of enamel and dent and the opacities that teeth have, the translucencies that teeth have, the maverick coloring that teeth have? And so that's really that's the art form of dentistry. That's my passion.
Well, when it comes to aesthetic and color, which is again my area of interest, I would like dental materials and the whole setup in the offices that would work for dentists in terms of providing that, let's not say ultimate, but the best aesthetics we can provide. This would include shade guides that would correspond to human teeth. So you do shade matching, and now it happens 3 or 4 times out of 10 that you say there is nothing that I really like. Well, we want to tailor shade guides to match teeth. And for those mismatches, you want materials that would compensate mismatch by exhibiting chameleon, which is, just for the record, it's a jargon, so don't quote me that I ever said chameleon without this. Chameleon is a dental language. Nobody in color science knows that word. That's kind of we made it up. So this is blending effect or color adjustment of dental materials, but again, for the sake of communication with colleagues, we use that word chameleon always under quotation marks. So that would be the goal, to have something to teach dental professionals how to match shade, give them proper conditions, methods, communication tools, to give them shade guides that would match human teeth, and finally to give them materials that will be their friends instead of being their foe. So at some point in the future, hopefully, all those will meet and will proceed towards more predictable restorations.